Hey guys, Jeff here. I have another video for you. This is on schizoaffective disorder. Any of you who've been struggling with schizoaffective disorder know how deadly it can be and how frustrating it can be. What is schizoaffective disorder? It is a long-term mental illness that affects how you think, feel, or act around others. It involves both psychosis, which is a loss of reality, along with depression or mania. I am not a licensed psychiatrist or a specialist or even a therapist. I am at the mercy of my research just like everybody else, but I feel that I can help people along the way to my success. The cause of schizoaffective disorder is not known. It is believed to be an imbalance of chemicals that control thought and mood. So what are the signs and symptoms? We have delusions, which is basically thinking that something that is not real, such as you are a famous person or you believe someone is spying on you, or hallucinations, which you're seeing things or hearing things or tasting or smelling things that are not real. Disordered thinking or speech. For instance, when you talk, you move from one subject to another that does not make sense. You may make up your own words or sounds. Depression is another one, and manic behavior. Keep in mind there's much more to schizoaffective disorder than just these signs or symptoms. Just because you have some of these does not mean that you may have schizoaffective disorder. Again, you will need to see your healthcare provider, a psychiatrist, and a therapist to really understand if you do have it. So how is it diagnosed? Your healthcare provider will perform a psychiatric assessment. He will ask you if you have a history of psychological trauma, abuse, sexual abuse, or mental abuse. Do you have a history of alcohol or drug use? They will ask you if you wish to kill yourself or others. The answer to these questions will help your healthcare provider plan a treatment. So what medications are used to treat schizoaffective disorder? You have antipsychotics, anti-anxiety medicine, antidepressants, mood stabilizers, anticonvulsants, blood pressure medicines, and medications that could decrease side effects. So what therapy is used? You have assertive community therapy, which is where providers and communities help you with your therapy. Cognitive behavioral therapy. This therapy helps you change certain behaviors. Compliance therapy. You find it easier to be able to take your medications on a schedule. And there's counseling, which helps you with self-care, how to decrease your symptoms and prevent them from coming back. Now, how can I help manage my schizoaffective disorder? Family and support are the number one thing that you can do to help manage them. Keep all medical appointments. I cannot stress this enough. You have to go to your appointments to be able to have a professional follow-up with you. Take your medications as directed. A lot of people, they will take medications and they will stop because they feel better and then relapse because they realized it was the medication that helped them feel better. So what are the risks to having schizoaffective disorder? Even with treatment, your symptoms may come back or never go away. If schizoaffective disorder is left untreated, your condition may get worse. Your condition may make it hard to live a normal life. You may be at an increased risk for diabetes, heart or lung disease. Your risk for alcohol or drug abuse increases, and you may have thoughts of hurting or killing yourself or others. Guys, my experience with schizoaffective disorder, ever since I was a young boy, I would hear things. I would hear music playing in the background, or I would hear a phone ring that wasn't there, or I would hear voices that wasn't there. Sometimes they were audible voices, sometimes they were in my head. I finally decided to go get treatment, and I'm 31 now. I'm on medication that is helping for sure. So if you out there have schizoaffective disorder or any type of mental illness whatsoever, you will want to get treatment and not put it off. That is very important. Thank you guys. I hope you have a great day. Subscribe and hit that like button.